I'm Dr. Abhishek Mangeshikar, an endometriosis specialist and excision surgeon. Today, I want to talk about something very close to my heart, how we can all help raise better awareness about endometriosis right within our own communities. Endometriosis affects 1 in 7 women and people assigned female at birth, yet it is still widely misunderstood and undiagnosed around the world. Many of my patients tell me they went years, sometimes even decades without a proper diagnosis, often being told their pain was normal or just bad periods. This is why advocacy and education matter so much. It's not just the job of doctors and researchers. Everyone can play a role in spreading awareness and helping others understand this disease. In this video, I'll share why endometriosis awareness is still urgently needed, simple practical ways you can advocate within your community, how to support others living with this disease, and why your voice matters, whether you are a patient, a caregiver, a healthcare provider, or an ally. Let's begin. First, why is this still such a critical issue? Despite growing attention in recent years, endometriosis is still underdiagnosed worldwide. Patients often face long diagnostic delays on an average from 7 to 10 years. Dismissal of symptoms, being told it's just period pain, misinformation, myths that endometriosis can be cured by pregnancy or hysterectomy, lack of access to skilled excision surgeons, meaning many undergo ineffective treatments like ablation or hormonal suppression alone. Awareness is the first step forward toward changing this. When we raise awareness, patients seek help sooner. Families, teachers, and employers gain understanding. More funding goes towards research. More doctors pursue specialized training. You don't need to be a doctor or a public speaker to make a difference. Here are some ways anyone can help raise awareness. Start conversations. Talk about endometriosis in your everyday life with friends and family, in schools and universities, in the workplace. Many people still have no idea what endometriosis is. Simply having these conversations helps normalize the topic and reduce stigma. Share accurate information. When posting on social media or speaking about endometriosis, always aim to share reliable resources from endometriosis centers, medical journals, or respected organizations. Correct common myths, such as the idea that it's just bad periods or that pregnancy is a cure. Highlight the importance of excision surgery, the gold standard of treatment, not ablation. Support awareness campaigns. Participate in or promote Endometriosis Awareness Month, wear yellow days or other local awareness events, advocacy walks and fundraisers for research. Even small gestures like wearing an awareness ribbon, posting an educational graphic can help spark conversations. Empower and support patients. If someone in your life has endometriosis, believe them. Listen without judgment. Encourage them to seek specialized care. Advocate for better understanding at their school or workplace if needed. For patients, your voice matters the most. Sharing your story helps others feel less alone and educates the public and even healthcare providers. As an endometriosis specialist, I also see advocacy as a crucial part of my role. In our practice, we educate patients and families about the disease and proper treatments, work to train the next generations of surgeons in excision techniques, participate in medical conferences and public education events, collaborate with patient advocacy groups to amplify patient voices. But most importantly, we want to empower patients themselves to be advocates. When patients are informed, they can advocate for themselves in the healthcare system, support others going through similar struggles, push for systemic change in how endometriosis is diagnosed and treated. Please remember this: you do not need to be a medical expert to make a difference. Whether you are a patient sharing your experience, a parent supporting your child, a teacher advocating for better menstrual and health education, a friend helping reduce stigma in your social circle, a doctor striving to improve your understanding and practice, every voice matters. It is only through collective awareness and advocacy that we will reduce diagnostic delays, improve access to proper treatment, increase funding for research, and ultimately change the lives of millions of women and girls living with this disease. If you take away one message from this video, let it be this: you can be an advocate right where you are. Talk about endometriosis, educate yourself and others, support those living with the disease, challenge the myths and stigma, and push for better care and understanding in your community, your healthcare system, your country. Change begins with awareness, and awareness begins with us. Thank you for watching. I hope this video has inspired you to think about how you can help raise awareness for endometriosis within your community. If you have ideas, experiences, or advocacy work you'd like to share, please leave a comment. Your story could inspire someone else to take action. And if you found this helpful, please like, share, and subscribe for more expert content on endometriosis, pelvic health, and excision surgery. Together, we can build a future where no one has to suffer in silence with this disease. Take care, and I'll see you in the next video.